Okay, we're gonna go ahead and get started. Hello everyone, I'm Shannon Udy. I am the program manager for our Good Health and Wellness program here at the Great Plains Tribal Leaders Health Board in Rapid City, South Dakota. And today for our community health webinar series, we have Colin Welker with us today from the Public Health Law Center. And Colin is going to be going over the importance of policy in tribal communities, and we're going to examine policy systems and environmental change and how they can work together to advance the health of a community. Before I pass it over to Colin, just a few things. We are in a webinar setting, so everyone's microphones are currently turned off. So if you do have questions, we will be answering them at the end of the webinar today. So please feel free to use your chat feature. Also, if you'd like to go ahead and introduce yourselves, please feel free to do so in the chat. We also have the Q&A feature at the bottom of your screens. So if you prefer to ask a question with that feature, you can do that as well. We'll be checking both of those for questions at the end. As you can see, this webinar is being recorded. So a link to this recording will be sent out after today's webinar. So you will have the slides available and the recording available to you after this. Without further ado, I am going to pass it over to Colin to present our webinar today. Thanks, Colin.
Yeah, thanks, Shannon. And thanks everyone for joining me today for this webinar. Just want to introduce myself quick. My name is Colin Welker, and I'm a policy analyst with the Public Health Law Center. And I'm just going to spend the next just probably under an hour walking through today's webinar titled Policy into Practice, what it means to work on policy systems and environmental changes, with a little bit more focus on policy, since that's really where our expertise at the Public Health Law Center lies. I'd like to just acknowledge that the land that I'm on today in St. Paul, Minnesota, that's where the Public Health Law Center is based. It is known as the Bedote region, and that's where the Mississippi and the Minnesota rivers meet, and it's the birthplace for all things for the Dakota people. I just wanted to take a second to acknowledge the land I'm on today as we move forward. So let's get into the presentation. So I just wanted to share a quick picture of our team. I'm just one of many attorneys and policy analysts that we have at the Public Health Law Center. There's a small group of us that work on tribal public health law and policy, and that's what my background is in. So happy to join you today. And that's our wonderful staff. But if you're not familiar with the Public Health Law Center, we really do legal technical assistance, and our work is founded on the principle that everyone deserves to be healthy. And so we work to support public health officials, advocates like yourselves, researchers, community groups, in developing public health laws and policies grounded in community, in good science, lived experience, and good legal principles. We focus on public health policies to prevent and reduce chronic diseases and promote health equity. And we concentrate on kind of these 4 issue areas here, which are supporting communities and developing policies that help them be free of the harms of commercial tobacco products, have culturally appropriate opportunities to be physically active, and culturally appropriate access to affordable, healthy foods. And then we also have a new climate justice project that focuses on indoor environmental health issues for housing. That's a little bit about what we do. Just in short, we do legal research as well. We help with policy development, implementation, defense. We do lots of different publications around policies, and then we offer trainings like today's. Our attorneys and policy analysts do not directly represent anyone, and we also do not lobby. But I just want to acknowledge that if you need help working on a policy or have questions about the law and need any assistance, we are here to help and offer that free legal technical assistance. So we can get into the substantive stuff here, but I just wanted to acknowledge kind of the objectives that we're going to work on today. So we're just going to refresh our knowledge about what PS policy systems and environmental work is and why it matters. I think you all probably live this stuff every day, but I just think it's important to see how these things can work together with policy, the systems and environment, and programmatic work, and just hopefully to deepen your comfort level with policy development. So we just have a quick poll question to get us started here. I think Shannon's going to pop that up onto your screen. So if you'd like to answer, that would be great. So it's just about the experience you have working on policy in your community. If you're comfortable a little bit, would like to know more, or unfamiliar with policy process. We'll give everyone a second and then we'll just share the results. And then whenever you want, Shannon, I think you can share the results. Nice, so we have a pretty good split here. Some people that are pretty comfortable. The majority of folks have worked on policy a little bit, but want to know a little bit more. And then a few that are new and unfamiliar with the policy process. So I hope you can all take something away from today's webinar. And then, as Shannon mentioned, I'll be around at the end to answer any questions. And if I can't answer it right away, we can set up a time to follow up and dig into that. So I wanted to start with some shared definitions here. So you'll see these on the screen. I realize it's a lot of text on these ones, but you'll see these throughout the coming slides. And these ones are from the American Indian Cancer Foundation. Little plug, I used to work for them, but I thought these were great, definitions, really tailored to Indian country. So I'm just going to read them quick. So they define policy, systems, and environment as the following. So policy can be thought of as the guiding principles for ways of living, like respecting elders, never taking more than needed, and respect for all living things. Systems are the building blocks of a community that allow it to function as a whole and ensure its well-being. That being our families, clans, our food systems, medicine systems, different government systems, tribal council. And then environment is both the natural and built world that surrounds us and the way we physically interact with it. This includes activities like planting gardens, fertilizing the ground, or harvesting food, and seasonal practices for survival. So lots of different institutions and organizations have, pretty bureaucratic definitions for PSC work. But I think that ACAF's, American Indian Cancer Foundation, here are really, really nice and tailored to the work you all do. So we'll dive into each of these a little bit more here. So what is policy? We have the definition I just read up in the top, but that's really, we're looking at laws, ordinances, resolutions, mandates, regulations. It can be organizational guidelines, things like rules or practices, but it can be things as simple as departmental policies as well. Thinking about like a health department's policy about commercial tobacco use, for example. But I want to start, I think, as we get into this talk here, by grounding us in thinking about really just the many forms that tribal law can take. Treaties are an important source of law, and they can show up in more than one way. We see executive orders here. We saw those a lot during the COVID-19 pandemic. We have resolutions and ordinances. We have codes or code sections, regulations, constitutions. All these different things are forms of law and policies in tribal communities. There's customary law and departmental policies, compacts, things like that. But a question I often get, or we often get at Public Health Law Center, is what's the difference between resolution and an ordinance? And that really, it varies from tribe to tribe, of course, and you might want to ask your tribal attorney for clarity if you don't know. But in a classic sense, or in a general sense, resolutions tend to be a statement of intention of support for a policy. So sometimes you can see that in those whereas clauses, if you're familiar with that. That's oftentimes used in a resolution format. And then ordinances or code sections create something that is enforceable. So that's really the difference. But sometimes resolutions are used to pass codes or ordinances as well. And then another one we get a question about is ordinance versus code. So using the phrase code or code sections may bring stronger connotations of sovereignty in contrast to the word ordinance, because ordinances are often used outside of Indian country to describe local government laws, like laws for cities, counties, municipalities, things like that. So I think generally speaking, if you use code, which I think a lot of tribes do use code, I think that brings a little stronger connotation again of sovereignty. Similar to US federal and state agencies, tribal governments may also have agencies or departments that issue regulations to implement laws. I mentioned that briefly. Case law, which is another form of law we don't often hear about, but that's just decisions made by courts, tribal courts, the US Supreme Courts, and other types of courts. So they define laws through different case decisions. And then there's customary law. And these things your community will know best, but it can be found in oral traditions or held by elders or community members. So those things, those are kind of just the different ways that laws and policies can take place or live in a tribal community. So just some brief examples of policy change, just very simple, of things that we've helped work on, or I know that are part of Good Health and Wellness in Indian Country projects or objectives. There's things like the right to breastfeed law. An example of another policy would be paid parental leave policy for tribal employees. Another one is thinking about tribal schools not withholding recess as punishment. Say a child or a young person does something wrong, we don't withhold recess. And we'll get into equitable policy provisions a little bit later on, but these are equitable policies, and that's why I've laid these ones out. And then another one is updating a policy change idea. Could be updating tribal school policy that comprehensively addresses e-cigarettes, and then also rejects the commercial tobacco industry support or monetary support. Sometimes the cigarette companies try to support schools through donations and things like that. So that's just a quick overview of policy, the P and PS&E. So now we're going to talk about systems. Again, we have that ACAP definition in the red on the top, but this is really the processes, procedures, relationships, and power structures in a community or in your organization. It's the way that organizations and communities operate or do their work. So here's some examples of systems change, but I think it's important to note, and I find this to be very true, and you may all in your work as well, but these system changes, the S and the PS&E and policy change really more often than not go hand in hand. So they really play off of each other. A policy helps to enforce the new system change, for example. So some examples here are tribal systems changes that tribal communities have adopted are tribal child care directors and staff are trained to offer educational supports to expecting parents or new parents about breastfeeding. Another one is the community prioritizes safe and active routes to parks or food outlets, or maybe other important community places, like a community center in community planning. So that's a systems change. And then commercial tobacco point of sale enforcement policies and measures focus on the retailers, the tobacco retailers, instead of youth, and mitigate PUP laws. We call them purchase, use, or possession. So putting the responsibility on the retailer, not on the youth or young adult that may be trying to purchase a tobacco product. So those are some examples of system change. And I think just inherently you can see how policies work together with those to support them. So then we have environment, the E, the P, and the PS and E. So these are really the settings and spaces within which organizations operate and within which people live, work, study, play, and pray. So the environment it can be tangible or intangible. And by tangible, I mean these are the physical structures or the built environment in which we live in. And then there's intangible environment as well. And an example of that is um, cultural or social or economic dynamics that may be part of the community. So we have some examples here of environmental change. Again, they all work together, but these ones can live a little bit more independently. But some examples again of tribal communities of what they've done is create lactation space or facilities to support breastfeeding employees, students, and community members. Ensure work sites or tribal government offices offer facilities to support active transportation, like even just providing bike racks for folks or having safe trails to exercise on, for employees to exercise on a lunch break or something like that. And then we have reducing youth exposure to commercial tobacco in places like schools, trails, parks, recreation areas, and workplaces. So those are environmental changes. Again, you can see how policy can really add some weight to these environmental changes and make them enforceable. So a common question from people working on public health issues, like a lot of the ones I've laid out, is how does program work fit in with all of this? Um, Program work is really important for policy change, and just as I was alluding to, they go hand in hand. Programs can be an effective way to start to build support for policy change in the areas that you all are working in a health department or maybe a clinical program. Those examples in particular often provide a really strong foundation for policy change. Um, and I mean that because programs are voluntary and typically focus on providing needed services. They are less likely to provoke resistance from the community. So they can be a good way to engage stakeholders, introduce the idea of new changes. They're a really great place to help build buy-in, which leads to policy development, which in the long term can bring sustainability to programmatic efforts. So these are just some examples. I think that's the key right here, is that PSE work can bring long-term sustainability to your programmatic efforts. So I have some examples that I thought were beneficial to kind of exploring this idea of how they are all working together. So the first one I have here is this wheel here of showing how they're all interconnected, but I'll start with cessation services or cessation programs for commercial tobacco users. So we know that clinical nicotine cessation programs and services are essential component for effective implementation of policies to reduce harmful commercial tobacco use in the community. And we provide these services, and when we do so, it helps people feel supported in quitting the harmful smoking of commercial tobacco products. And for tribes where tobacco is a sacred medicine, programs that educate and support sacred use of tobacco have been shown to support quitting of harmful commercial tobacco use. As well, for youth, programs that help youth to understand how the big tobacco industry, including e-cigarette companies like Juul, have targeted them and misled people about the addictiveness and harms of their products, can help people resist the marketing. And these programs make smoke-free policies, but not sacred use policies, but the programs make commercial tobacco-free policies more effective because they provide options and support people in being effective. So you can just see how they're all connected. We have a policy, but we make sure that in that policy, we are connecting people to services to help them quit using commercial tobacco. And then we're educating them on the policy throughout the process, which we're going to talk a little bit more about the policy development process later on. But this policy here is from the Oglala Sioux tribe, and this shows how some of these educational pieces I just mentioned are important for supporting policy. So much so that they referred to them right in this policy. You can see in the third whereas clause that is called out. It says electronic cigarette or electronic smoking device companies are marketing the products to the public and especially to young adults as safe alternatives to tobacco cigarettes and an easy way to quit smoking tobacco cigarettes. And many companies are enticing young people and others to use electronic cigarette devices or electronic smoking devices, excuse me, with attractive flavors, etc. So they really found that to be an important part of just educating the general public through this policy and putting it right into their resolution into their policy. This example here is food systems, and I realize that this is maybe a little hard to read. So when I think this is being recorded, so I'll send out these resources to be disseminated to you after. But the food policy area also provides many good examples of the importance of programs here and programs and policies working together. I think healthy eating policies, excuse me, can be controversial. People have strong feelings about food. I do myself, but people have, no one wants to be told what they should or should not eat. And very few of us like being the food police. We don't want to, be having to play that role. So with healthy eating work in general, whether in Indian country or outside of Indian country, there are lots of programmatic efforts. Think like WIC, SNAP, commodities, school lunch programs, elder nutrition, summer feeding, diabetes prevention programs, and there's many more programmatic efforts that aim to get people healthy food. And these programs, again, can be a really important lever to shape food policy and change the food systems within your community. So this handout really visualizes or helps to visualize how a small food system within an organization or a tribe, or maybe like a health center, is built through policies and programs that work harmoniously and synergistically together. So you can see here that maybe there's an on-site garden that's could be a programmatic effort, having a community garden, but then it can lead to a community kitchen where we're teaching people how to, use fresh, local, indigenous foods that can be sold at a farmer's market. But then that can be linked back into maybe a clinic policy where we're referring people that are pre-diabetic to get a veggie prescription to make them access the farmer's market or the community garden to be able to get those fresh fruits and veggies and fresh foods, fresher indigenous foods to help support them to become healthier. Again, just a quick example of how those can work together. This is just one final one here. To show how they fit together and help connect all the work. This is the food sovereignty framework. And this one's pretty impressive. It's from the Food Sovereignty Strategic Plan by Blackfeet Nation. And it has 4 pillars. I know that this is probably a little bit hard to see too, but again, it has 4 pillars, and policy is one of the pillars, along with youth engagement, self-sufficiency, and partnerships. But if you look at the other pillar sections, you can see throughout this thing that policy ideas are embedded in almost all of them, all of the different pillars. And it's certainly relevant to all of them. But along with policy is also community and partner engagement. And we'll talk about the importance of that in the second half of today's webinar. So I can send the link to this resource as well. So this is just some more examples, just broken down of how programs and policies work together to reinforce each other. So I'll just go through a couple of these here. Say the program, we mentioned the community garden. Another policy you could have that works with the community garden program is a commercial tobacco-free policy for the garden. And then also highlighting and supporting the need for traditional medicines to be grown in the garden and making that a line item in the tribe's budget so that we support that program, but we're also supporting the access to traditional or ceremonial tobacco if needed. Another one is the Tribal Health Department celebrates Breastfeeding Awareness Month with educational programs and activities, maybe a tabling event or tabling program, something like that at the health center. But a way a policy could support that is the tribe adopts a breastfeeding policy for employees, and it provides lactation spaces across tribal settings and events. So it's suitable for employees or visitors to those areas, in this case, specifically the health department. So these are just some different ideas how programs and policies can work together. So a strength of policies and laws is that people don't get to opt in, but are bound by it by virtue of being a citizen. And so policies shape the community norms. That's what they do. They establish roles and responsibilities and set forth principles that shape actions across the tribal community, across time, though. It takes time. Good laws and good policies reflect the values and beliefs of their communities and also impact community norms because they both shape and are a part of the social framework of a community. Again, laws and policies embed these changes into a community, so it takes some effort to reverse, excuse me. But they also create sustained change, which I think is really important, and that's why it's so important to understand how policy systems and environmental changes can all work together, because coming at it from that approach creates a sustained change that can positively impact the health of our tribal communities. I'm going to go into the next section, and it kind of, again, this is a little bit more focused on policy, but I wanted to talk through a framework that we use here at Public Health Law Center to discuss equity at every stage of policy development. So these things, you'll see how they can tie in again to that programmatic work or that PSE work. You can tie the systems and environments into your policies. I think this is good knowledge for everyone to have, especially those of you who are willing to help write policies or are tasked with that. Maybe it's in your grant or program deliverable to do so. So I'm going to go through the 6 essential stages of law and policy, and again, we'll go through them and talk about equity at each stage of them. But just briefly, the 6 stages are research, evidence, and expertise. We have identifying solutions, the drafting and scope of a policy. We have advocacy, implementation and education, enforcement, and evaluation. Let's dive into each of these a little bit more here. So the first stage, again, is evidence, research, and expertise. And so this is really a crucial part of good policy development, is collecting your evidence, collecting your research, and then marshaling your expertise as a community employee or a community member to make a policy that is reflects the community and what the needs are. So this PSE work starts off with being curious, connecting with people, connecting with community members, and research. And sometimes that takes outside help, TA providers, to help do research or host focus groups, whatever it may be. But it's really where you're going to start to get your community buy-in and support and education. And it needs to happen throughout this whole process. But this is really the beginning. And again, I mentioned that those programmatic efforts are a really great place to start finding champions, community champions, finding community support and that buy-in. But when I talk about research, I'm talking about evidence, that's scientific evidence, expertise. In the purposes of our work, we think of it covering traditional knowledge, if you're looking to elders or traditional leaders in your community. And then it's also about knowing how policies or laws get passed in your community. And then thinking about too, right at this stage, who's going to support this and then who may oppose it. So just something to keep in the back of your mind as you're working through this. But I want to reiterate that, a lot of times people focus on, when collecting data and knowledge, they're thinking of quantitative and qualitative data. to use public health terms or Western science terms, but I think it's really important to bring in lived experience, traditional and cultural teachings and knowledge that has been proven over many generations. And this is a great place to harness all that knowledge and put it into to your policy so it can reflect the community as best as possible. So we're going to talk about the next stage, which is scope and drafting. So this is really a part where Public Health Law Center, if you're working on a policy and you have questions, I'd be happy to help. I know there's other people out there that can help too. But this part here is really important because when we're scoping and drafting the policy, we want to make sure they are covering exactly what we want it to do. So we want to make our goals clear and concise. And by doing so, we can make sure that once the policy is implemented, it's addressing exactly what you want it to. If it's drafted well, if it's clear, it will be effective. It will and it will do so without harming equity. It will do no further harm. So you see these things here. Some things to consider are exemptions that don't further the harm for an individual. Think like a smoke-free housing policy, for example. If we're the first violation, someone's caught smoking a commercial tobacco product in their house and they're evicted, well, maybe that's not a great mechanism to get them to quit smoking, because now they're having a housing insecurity issue, things like that. I have some more examples later on. But here too, in this drafting part, words matter, and I think this is a great place to remember. If we can use Indigenous language to do so, we can draw on our culture and our values, and then we can use gender neutral language as well. So just reiterating that words really matter in the policy, and especially in this stage of policy development process. So here's some examples. I alluded to one just a moments ago about smoke-free housing, but we want to make sure that our provisions do no further harm. So we don't want to penalize youth for underage possession or purchase or use of tobacco product industries, because we have to think about the industry's tactics to manipulate and market their deadly products to youth and young people. So again, putting that responsibility back on the tobacco industry. Things like suspension in schools. If a young person is caught using a commercial tobacco product in schools, we want to think about things that are alternatives to suspension, because we want to keep kids in school. I know I'm just kind of flying through these examples, but these are just some things to consider to make sure that our policies are equitable. And sometimes we want to reduce the interaction people face with law enforcement, because we don't want our policies to contribute to mass incarceration or the criminalization of poverty in any way. So this example here is from Sault Ste. Marie tribe of Chippewa Indian in northern Michigan. I know it's hard to leave, but they have a graduated enforcement. So it really focuses on if a young person gets caught using a nicotine product, in this case is what they defined it as, it's really an education. They're really going to focus on making sure that youth or young adult is connected to first cessation services, and then also working with them on education about the harmful products that are commercial tobacco. And the next phase of policy development and it also relates to community engagement, is advocacy. So when we're talking about advocacy, it's important to think about both internal and external advocacy. Internal advocacy involves working with people in the community, and is probably a little more important, but it's important to also think about external entities that have potential to impact the effectiveness of your policy. So this, in this case, might be state or federal officials working with cross-border issues, maybe a neighboring tribe or tribal community is looking at passing a similar policy. So that's important to consider at this time as well. So this model here, this chart or wheels, Venn diagram, is from the Chunli Coalition and Cheyenne River Sioux Tribe, and Missouri Breaks made this, but it really shows how community engagement is at core, but there are pieces in other phases. So educating the community, educating key partners, so it really all connects. But again, advocacy is where we're going to really amplify those community voices to tribal decision makers to gauge interest in or to help pass a policy. A lot of times youth can be really effective in this area. And then things like educational events or programmatic events here is where that really ties into advancing policy. So I just have this slide too, as it relates to advocacy, about engaging tribal leadership. That's often a big question in people's minds, so I want to talk about it a little bit more specifically. And these are some potential strategies for making leadership more directly aware about an idea that will be presented, maybe at a tribal council meeting, and just try to get them to support your initiative. So things like scheduling one-on-one meetings, identifying maybe who on the tribal board of directors or tribal council could help champion your policy initiative. Ask them about their values and priorities. Perhaps they really have a youth focus. So maybe that's one place we can put our advocacy efforts, is engaging youth. Presenting what you heard in the community about why a need for a healthy food policy or a breastfeeding policy is important. Be ready to talk about the positive impact it's going to bring to the community, and then just thinking about just anticipating your potential questions or barriers that you may face, whether it's a commercial tobacco initiative and we're worried about revenue loss. Well, that's a real concern. So thinking through how you can highlight the positive impact the health of the community will have because of your policy. Another reason this advocacy work is so important because it really prepares you for dealing with tough questions. And at a certain point, you might be faced with a decision about a policy you've been working on for maybe it's years. So it's that judgment call, or these deal breakers. Part of you may want to see it to completion, even if the policy is weaker than what you envisioned. But there are some things that you won't want to compromise on. So knowing well in advance what is a deal breaker for you, or a coalition or a group you're working with, will help prepare you for this whole process. So if you're working on, say, a smoke-free policy and a tribal council wants to exempt maybe the bingo hall, is that a deal breaker to you? So knowing those things ahead of time so you don't get caught off guard. And it's okay to answer this in different ways. Just making sure that you know that ahead of time, or have your deal breakers defined going into maybe a tribal council meeting or something like that. Now let's move on and talk through implementation and education. So this, there's some interest, I think, across Indian country, and maybe some are familiar with the Healthy Dene Nation Act, in the junk food tax, or as a kind of more layman's term. This kind of policy has a lot of implementation and educational aspects. So I'm going to talk a little bit about the context of Navajo Nation's Healthy Dene Nation Act. And this was adopted back in 2014. And the advocates really started working on this in a coalition in 2012. They had a real strong media and social impact and presence from the beginning to educate the community and to mobilize the community members to bring this idea to their leadership. In bills, in Navajo Nation, they have bills that they introduced. It was proposed 3 different times and it didn't pass, but on that final time it did pass. So I won't go into the whole history of this, but this is just an example of a policy that took a long time to pass. If you're not familiar with it, it taxes unhealthy foods. It removed the tax on water and fresh produce for being purchased on Navajo Nation. And then it taxed things like energy drinks, sugar sweetened beverages, processed foods, things like that. So what was really interesting important in this is that the community realized that the revenues that were generated by this tax were used to support community wellness programs. So they funded things like the education department, different chapters were funded on Navajo Nation. And you can see here that this is their language, that 100% of the Healthy Donation Act revenue collected shall be deposited into community wellness development projects. So that's a way a policy is linking right back to community programming. And it really shows the vital role of implementation and education in this kind of effort, because they educated the community in such a positive way that it was really, really well received. And then we see the positive impacts still lasting today in their community because of the wellness programs that they have been able to fund from this revenue that was generated. So again, implementation and education is a process. It starts long before the policy is adopted, but it keeps going after it's on the books or is codified into the law. So it's important to understand how the policy is working throughout the process. But one important area is they conducted a community survey, and they really wanted to know how to implement the community wellness projects. After the revenue was dedicated to those community wellness projects, how are they going to do that? So they did a survey and found out what people, what the community wanted in a wellness project. And so then they implemented that. So again, it's involving that community, engaging the community from the very beginning, but also throughout the policy process and after too, making it easy for the community to know about the policy, and then making this implementation guide here is just a quick informational fact sheet about what the policy does. And so it really explained how these community wellness projects funded with the tax revenue could be implemented and what you could use it for. We've talked a little bit about this, but it's true. Many public health policies are challenging to enforce because they are trying to change social norms, which should be self-enforcing, but it's difficult. For example, I have the most experience with smoke-free policies. For these to work, it really requires participation from communities, businesses, customers, residents, from everyone. To make a policy successful. So we want to design enforcement strategies that do not, again, contribute to systemic oppression. So I have listed here graduated enforcement. And that's really where you start off, like I mentioned previously with the Sault Ste. Marie tribe example, we start off with education or a warning, and harsher penalties are an absolute last resort. So really far down on the enforcement the enforcement strategy for a policy. A place where that can be particularly important is in, again, that smoke-free multi-unit housing. We don't want to contribute to housing insecurity, because if you adopt a smoke-free housing policy and someone is caught violating it for the first time, you evict them, we're likely contributing to that disparity in housing. So if you impose a fine, though, if you're thinking like, I'm going to fine them $150 or $100, whatever it may be, we might be exacerbating economic disparities too. So that's why we really often suggest that graduated enforcement in this context. So maybe a first violation results in a verbal warning, a second violation results in a written warning. And if you ever consider something like eviction at all, and many policies don't these days, it should really be a last resort after all other options have been exhausted. These other things listed here, restorative justice, we see that a lot of times in schoolwork, keeping youth and young adults out of the criminal justice system. A lot of those programs have culture as prevention as a key component or centered in the programming itself. So referring individuals that are struggling with a new policy, whether it's a commercial tobacco policy, a healthy foods policy, referring them back to those community programs, and centering culture is really important if possible. And then language consideration, if signage is a big thing in commercial tobacco-free policies. If you can do it in your tribe's language, even better. So another thing to think about is evaluating the policy, and I kind of touched on this with the Healthy Donation Act, but you want to evaluate the policy to make sure it's not creating those burdens that we tried to avoid for the community members. We want to understand the relevant factors for understanding the impact and the cause of inequity should they be happening. But you might find out what's working really well too in an evaluation of a policy. So I just want to bring us back as we wrap up here to this: what is effective law or policy? And we at Public Health Law Center really find an effective law or policy is equitable, it advances health equity, and it does no further harm to community members. It's easy to understand and follow by those that it's regulating, and really, most importantly, it reflects community buy-in. Of course, we want it to accomplish the goals and be evidence-based, whether that's scientific evidence, community-based evidence, programmatic data we have. And then we want to limit exemptions as well to the policy. So policies built on these ideas are really going to have the best chance of helping our communities, your communities, realize their full potential to lead to healthy futures that we want for our families and our neighbors. So this is just a resource. I'll also include this to be disseminated with the recording as well. This just kind of goes through more in depth all of those areas that I touched on about drafting tribal public health laws and policies. But I did want to leave about 10 minutes. Looks like we're on time for that for questions, should anyone have any. This is my contact information. You can reach out to myself or just Public Health Law Center in general if you have questions about any of this and need help writing or drafting policies. Again, we have that. We have funding to offer you free legal technical assistance on a variety of public health policy initiatives. Well, thanks for listening. I hope that was helpful to everyone. And like I said, I'm ready for questions should anyone have them.
Thank you so much, Colin. Loved all of your examples and policies that you shared in your presentation today. Like you said, yes, please feel free to use the Q&A function. I also realized at the very beginning, I think the chat was disabled. So I do apologize if those first couple of minutes you were trying to use the chat and it wasn't working. It is open now. So please feel free to use chat if you have questions that way. While we are waiting, in case anyone does have questions, I am putting a link to an evaluation survey in the chat. Just a quick couple questions that help us with future webinars.
And like I said, if you have questions and want to just email me, that's fine too. If you have a specific question, that's very available for that as well.
So. Well, yes, I will. Thank you, Colin, for providing those resources. Like you said, we'll be sending out the recording in a couple days, so keep a lookout for that, and we will be including the slides and any other resources and handouts that Colin went over today. So you all have access to those. I don't see any questions coming in right now, so I do just want to say thank you again, Colin, for joining us
Thanks
today
for having me.
and providing all your information. We can stay on for a few more minutes in case anyone has some last minute questions. Otherwise, thank you all so much for joining us today, and be on the lookout for the follow-up. We do have a comment in the chat, Colin, of working for a nonprofit that serves the urban Native community. If you have any resources that help with that, they would appreciate it.
Yeah, sure. We've done a little bit of work, or I have, with some of the urban, a couple of urban tribal health centers that are working on these types of policies. So do you have an email that would be best? Is it Madeline? And we can follow up and we can talk about. Perfect. I'm going to copy that. And I can send over some things that I think might be helpful, but maybe we can talk to specifically. Great.
Wonderful. Great. Okay, well, if we don't have any other questions, we'll go ahead and wrap up just a few minutes early today. So again, thanks everyone for joining. Thank you to our presenter, Colin. And we will be sending out that follow-up and also an invitation for our next community health webinar series. So thank you, everyone, and hope you have a good rest of your day and rest of your week.
Bye. Thanks, everyone.